We performed the epidemiological analysis of trends in ruptured aortic aneurysm appearance in Sweden over a 20-year period. To identify all aortic ruptures in Sweden over this period, we used 3 national registries. That's the cause of death registry, the Swedish Vascular Registry, as well as the National Inpatient Registry in Sweden. Through these 3 registries, we could identify every single aortic rupture, whether it reached hospital or not, and whether it underwent repair or not. These data show that the epidemiology of ruptured AAA is changing quite rapidly in Sweden. The incidence of rupture has decreased by 1/3 in the whole population, and the mortality in rupture has gone down. Much of this is thanks to introduction of new technology, EVAR, for treatment of rupture, and EVAR has resulted in an increasing proportion of octogenarians presenting with rupture being offered active surgical treatment. Other aspects that have affected the incidence of ruptured AAA is obviously the changing prevalence of smoking, as well as screening and medical treatment for cardiovascular disease. One of the interesting findings in this study is that the benefits in management of ruptures are much more important in men than in women. Currently, when an aortic rupture occurs, 65% of the men with aortic rupture eventually succumb to this disease, while the mortality in aortic rupture for women is above 80%. And while we have seen a significant improvement in survival rate among men, the same improvement cannot be seen in women. Elderly women are less likely to get active treatment when they have a rupture, and are less likely to survive the treatment if they have an operation. This points to the need for improvements in management of ruptured aortic aneurysm in women specifically.